Thank you, Mr. Chairman. Morning, or excuse me, afternoon members. You know, all our sleep cycles are a little off. My name is Dick Lavine. I'm Senior Fiscal Analyst at the Center for Public Policy Priorities here in Austin. I'd like to start by kind of repeating what Representative Menendez said and what the prior witnesses said, which is the reason we have to deal with this really has to do with the confidence of the public and the taxpayers and the business community that when they pay money in, it is going to be spent the way we tell them it's going to be spent. From our point of view, that's especially important because it's our feeling that we don't have enough money, that our revenue system is not generating the money we need to make the investments that are going to be required so that we can be prosperous in the future. And I'm not just talking about health and human services. I'm obviously talking about public education and higher education and water and transportation and everything else. But we're not going to be able to go to the public to ask for those additional revenues unless they have some faith. So we are signed on to trying to deal with this problem for that reason. You know, I've had a lot of trouble getting my mind around how this even works. I mean, it sounds like magic beans, you know. They're there, you use them to certify the budget, and when you're done, they're still there, you know. So the best I've come up with, and let me see if I can do this without sounding too geeky, it's like on a computer. You have a certain amount of memory that you need to run your programs. You can have your browser open, your mail program open, whatever else program. And if you don't have sufficient RAM, sufficient memory, you can set up what's called virtual memory, where it borrows from the hard drive and it swaps files back and forth. It's not really in your memory, but virtually it is there. But at some point, that hard drive has another purpose, and you need to use that whole hard drive for that purpose. What you're left with memory is not enough to run the programs you need to run, and you have to go out and buy some more RAM. And I think that's the situation you're in here. You've been using that $5 billion to run programs, to provide services to the public. If you're going to diminish that $5 billion, however you're going to do it, reducing the fees, spending down the balance, or whatever, you need to find a replacement for that $5 billion. Otherwise, you won't be able to maintain the current level of services. You won't be able to run your programs. So essentially what you're going to be doing over whatever period of time is a sunset review of all 200 of these fees and decide if you need the fee, if it's appropriate for the amount, what are you going to do with the balance. What I would like to suggest is that you run a parallel sunset program, and I'm sure Chairman Otto, you've heard me say this many times in Ways and Means, where you go through the tax code also, and you look at all the exemptions and the special discounts and everything else in the tax code. Those should be, for their own reasons, subject to sunset review every, however you want to do it, 10 or 12 years, and that you do it in a parallel process. So as you're taking away from this $5 billion you've been relying on to certify the budget, you are adding so that from closing loopholes and reducing exemptions and all, so that you still have the same amount available to service your programs, the same amount of memory. And I don't know if you're all familiar with this, certainly people in Ways and Means are, the controller every 2 years puts out a report listing all the tax exemptions. You can go through there, you can see what we could do, or there's certain exclusions like we don't tax the many services to the sales tax. And look to see how you can balance reducing the revenue, the virtual revenue that you've been using from the GR dedicated balances with real revenue that you gain by reducing the exemptions or changing the special treatments. That's all I have to say. There's obviously lots of details on a lot of these funds, and other members of my office may be in here to talk about some of the health and human service funds. So this is just a very overview, but I think that you need to keep your mind on this is $5 billion is currently being used for good purposes in the budget, and before you take them away, you need to find another replacement so that you can maintain those services. Thank you.
Thank you for that helpful example, too.
I hope it works.
Members.